Croaky, and we're here at the Aboriginal and Torres Strait Islander Suicide Prevention Conference in Perth. And I've managed to bump into one of the keynote speakers here for the World Conference too later on in the week. Would you be so kind, Kahu, to introduce yourself?
Oh, kia ora, Dr Kahu McClintock, no Aotearoa. Look, I'm really privileged to be here. There's a couple of issues that are going on in New Zealand that we really want to be transparent about and assist our families. So one of them is the data sovereignty the discussions that are going on, and how do we make that easy for our families, and how do we measure how well we're doing in terms of supporting our families. So we have a number of government agencies who at the moment dominates that area and also say this is how it needs to be with families and this is what we need to do with them. And we actually think it should come from the families themselves, because it's about them and it's about improving their lives and making a difference. So government agencies, we believe, and there's the Ministry of Justice, the Ministry of Health, and Statistics New Zealand, who have a big domination in that area that actually haven't spoken to communities and families. So that's what we're talking about this week, and how do we make sure that they do have a say. We're also about letting go of grievances and bereavements and distress, and encouraging flourishing and thriving within our communities. And that's what our communities want too. That's around their aspirations for now and for the future. So,
and on both of those, will you be bringing solutions that you do think we can pick up on?
Oh, absolutely. One of them is we work with 47 communities throughout Aotearoa, and work them in terms of, we provided a backdrop in terms of funding and what they wanted to achieve with that, and then we worked alongside them. We gathered the evidence for them, and then we helped write the report with them, which was in partnership. So they were clear about, yes, that's what we wanted to do, and so we wrote it up for them for their records. They are publicly available, but if people want to use them, we say, well, in terms of data sovereignty, it still belongs to them. We might have funded it, but it still belongs to them. So any use of it in the future, if we use it, we always let them know, hey, we're going to profile because it was so, 47 fantastic community. And some of them were the first time that they had the ability, they had the chance really to do it for themselves. And all of them said, we'll continue this even though we won't be provided with funding, because it actually made a difference, and we have hope and encouraged by what we did with you. So absolutely.
And that's what you'll be talking about. You're delivering a couple of presentations.
Yes, that's right. Yeah, and we have a wellbeing measurement that's on today, and that's looking across the collaboration with Canada, the States, and with Aboriginal and Torres Strait. We believe that the measurement must be not on the framework, that Western framework of, how many qualifications have you got a house, those kind of things that are very much a Western framework, but more really on what are cultural indicators. So it might be for us our language, our access to our cultural knowledge, our access to our cultural spaces. So that will determine on how well we are culturally, if we can, and we know them, we can access them, and we engage with them. So our framework's set on that process.
Fantastic. Really look forward to hearing from you.
Thank you.
Thank you very much for talking to us before the conference.
Thank you.